Feeling stressed about the new mask guidance? You are not alone. And that's why Dr. George James is here to help ease some of that anxiety. He's a licensed marriage and family therapist at the Council for Relationships. And we love having him. Dr. James, you are so calming for us. So thank you for being here. Losing the masks is a really big change for people. Here's what President Biden said at the White House yesterday.
So all of us, let's be patient. Be patient with one another. You know, some may say, just feel more comfortable. Continue to wear a mask. They may feel that way. So if you're someone with a mask, you see them, please treat them with kindness and respect. We've had too much conflict, too much bitterness, too much anger, too much politicization of this issue about wearing masks. Let's put it to rest.
Great advice there to be patient with one another. What other advice do you have for people who might be fully vaccinated, but they're just not sure if they want to go without a mask just yet and they're stressed about it?
Yeah, you know, what I would say to people is to go at your own pace. You know, what I mean by that is that, you know, we were all nervous coming into the pandemic, not knowing, what do you mean wear a mask? How should I wear a mask? How should I do it? How long should I wear it? We were nervous. And then it came to this place where it became, for a lot of people, a symbol of safety. You know, even outside of the political thing, a lot of people just felt safe that, like, I have my mask, I'm protecting myself. So now to remove it, it's going to take a little bit. It's going to be a little bit challenging. It's going to feel weird and awkward to go back to just not having a mask. So go at your own pace, and that will be fine, and you will get there whenever you need to.
A lot of fully vaccinated folks are excited to go out without wearing masks, but they're concerned that they won't know if other people without masks are vaccinated too. Here's what Dr. Fauci told Andrea Mitchell this afternoon.
You can actually see people who are really, you know, at that transition period where they're not quite yet ready to take the mask off. But I believe as the days go by, as we get a week or two into this, people are going to start feeling much more comfortable with this idea of going in an indoor situation, and if you're vaccinated, taking the mask off.
What tips do you have for people going out again for the first time in a while? A lot of us haven't gone to restaurants or stores or hung out with friends in a long time, and we're just hedging about all those things because we're not sure we know how to do it anymore.
Yeah, you know, I love what Dr. Fauci said, right? You just, you know, some of this is just going to take time. And one of the things I would encourage people to think about is gradual exposure. And what I mean by that is that, you know, you don't just go out and do the biggest thing right away. Look, I love sports, but I'm not going to go to a Major League Baseball game for my first event with thousands of people. Maybe go to a little league game, maybe go to another event. Build yourself up to the place where you feel like, okay, I'm comfortable being around other people or indoors and having my mask off. Gradual exposure can get you there.
Dr. James, it's so funny you say that because the number one thing I want to do is go to a Yankees game in terms of like big events. And it's probably going to be the last thing I do because it just, I don't think I'd enjoy it. I'd be so nervous the whole time. You gotta ease your way in.
Exactly.
I have to ask you about kids. Yeah, you got to take it one step at a time, right? I have to ask you about kids. Kids 12 to 15 are now able to get the vaccine. That is really exciting news for a lot of families. What if your child is nervous about getting a COVID shot? What can parents do to support them and help make that experience less stressful for them?
The biggest thing that parents can do, adults can do, is to get your vaccine first. Make sure that you've gotten your vaccine. Make sure that you're sharing those stories with your child. Make sure that you're being that example, that model, so that they can see it. And it's like, okay, mom, dad, parents, grandparents, you've done it. Then I would say consult with your child's doctor and then treat it like any other vaccine. Yes, it might hurt a little bit in your arm. Here are some things that we can do. We can get some ice cream, even though you're 15. Like, there's just find ways to allow them to know the normal steps, but share your experiences and model that for them.
Hey, look, a treat like that works at any age. Our reward for getting vaccinated was Burger King. My husband hadn't had it in years. And so, look, you gotta do something to say, hey, we did it, right?
Exactly.
A lot of kids haven't seen their friends. Rewards are great at any age. Dr. James, a lot of kids haven't seen their friends in a really long time, and they might seem outwardly excited about socializing again, but they might have some worries or concerns inside that maybe they're not talking about or they're not able to express. Are there any things that parents should watch out for, any indicators that maybe their child is having some issues and might need some help there?
Yeah, one of the things that I really I'm excited about with this time, mid-May, is that we're close to the summer. And the summer is going to give us a good opportunity to test some of these things out, to hang out with other people, to be in small gatherings once again. And with your child, being able to see, are they willing to hang out? Are they turning down opportunities? Have conversations with them. Talk about it. Be open. If they're not talking about it, you bring it up. Maybe even invite a friend over. Once again, start small and build your way up. That will give them the confidence so that when it comes time for the fall, whatever they might be doing, whether it's school or college or beyond, they will now start to feel more comfortable.
Dr. James, is there a right and a wrong way to have family conversations about COVID-related stress? Any tips if everyone's sitting around the dinner table and they kind of want to talk out their feelings? Are there ways to go about it and things that you say, ooh, do not do this with your family or your kids. This is bound to backfire?
Now, that would be my best-selling book if I could tell you how to have the best conversations with your family at all times, regardless. But there are some things that we can think about, right? Once again, safety is important, and then peace of mind is something that I want people to think about, right? Safety is the protocols that we have to go through, the mask wearing, or even gradually moving away from that. But then also peace of mind. If I feel comfortable having only 2 or 3 people around in my family, then do that. You don't always have to get into an argument with your family members about what is right and what is not. Think about what is going to keep you safe and what is going to give you peace of mind. And lastly, have the conversation. I know too many people where you talk about your family members, but not actually talk with them. So have the conversation and then figure out what is best for you, and then go ahead and do that.
Sometimes you have to have the tough conversations. If you could do it with a little bit of kindness, it may just work out okay. Dr. James, you always send us into the weekend with so much less stress than we had at the start. Thank you so much. We're grateful for you.
Thank you. Glad to be here. Have a good one.